Donald Trump going scorched earth on Obamacare.
The Trump administration will immediately repeal and replace Obamacare.
Okay, federal health care premiums are scheduled to skyrocket across the country. So how's this going to impact the swing states? Here to break down the numbers, the chairman of business and finance at King's College here in New York City, Brian Brinberg. Professor, good morning to you.
Good to be here.
All right, before Friday's October surprise with James Comey, we got the Affordable Care Act October surprise, which was a gift for Donald Trump.
Absolutely. The data here has been so bad, not only on premium increases, but also on deductible increases, and especially in key states. You're looking at North Carolina, where the premium increase is 40%, in Pennsylvania, 53%. These are key battleground states, and so he's getting a little bit momentum because of these increases.
And in the state of Arizona, 116%.
Triple digit. And that matters. By the way, next door in New Mexico, they're looking at that and saying, well, what does that mean for us down the road, too? So a lot of key battleground states are seeing these big increases. These are pocketbook issues for voters. Sure. They care about this.
Okay, it's not just the premiums, though.
No.
It's the deductible. The deductible is going up as well.
Even in states where the premium's not going up that much, you still see deductible increases. Across the country, it's a 15% increase in deductibles from last year to this year. For an individual, that average now is $3,500. For a family, it's nearly $7,500.
Professor, explain to me, how did we get to this point? Because I remember before it was signed, of course we got to sign it before we can figure out what's pass it, figure out what's in it before we know that. We were told that the average American consumer would save $2,500 a year, and now it is so underwater the other way.
Well, it's all built on this problem of young people not signing up for the exchanges. Everything depended on that happening. It hasn't happened. As a result, the population who has enrolled has been sicker. Insurers haven't been able to get the premiums they need to cover their costs, so they've left the market. It's that death spiral effect, but it all started with that assumption that young people would buy into this. They haven't.
And unfortunately, the number of network providers has shrunk as well.
Yeah, even in situations where your premium maybe hasn't gone up that much and your deductible hasn't gone up that much, your network has probably narrowed. One of the ways that insurers are trying to save on costs is to funnel you to a smaller and smaller pool of doctors. So in many cases, people are actually losing their doctors.
So many times with the Affordable Care Act over the last number of years, bad news always came after the election. Why'd they mess up this time?
This is very politically inconvenient for Hillary Clinton. It's certainly been a help to Donald Trump because all the data has come up. People are seeing the data. They're feeling it as they go to enroll for these plans. And that's causing them to rethink, you know, what should I be doing in November? How should I be thinking about the next 4 years?
Can Donald Trump fix it?
He's got to get more specific. He can, absolutely he can. He hasn't given a plan that really has given people a sense that he knows how he wants to fix it. He's been very good at critiquing Obamacare, but he's got to provide more details if people are going to believe that he really does have a plan to bring their costs down, to expand their options, to create more choice.
Okay, well, we do know that she has supported the Affordable Care Act throughout its life.
Continues to do so, yeah.
It's been a problem for her. All right, Professor, thank you very much.
Good to be here.
All right.